Hi, everybody. I'm just getting set up here and there's a few more people coming in. Glad to see you all here though. And Ari, I see your message. We should be done before the end of this. So 5-10 minutes is just fine.
Thank you.
There we go. I just got a new computer, so I'm all discombobulated. Okay, it looks like we have the cohort, so I'm going to get started. Hi, everybody. I'm Erin Bell. I'm the director of the Global Experience Office. And as part of our jobs behind the scenes, not only are we helping with the application process, but we also have a number of things to review with you before you go. So a lot of what I'm going to talk about today is around policies and procedures. Really things that you need to know in terms of your responsibilities while you're on the ground, ways that you can reach out to Professor Matthews and should be reaching out to her, and expectations that she's going to have of you while you're there. So really, this is an overview of those policies and protocols, and also some health and safety things to think about while you're in Hawaii. But I want to leave some time for questions if you have them as well. And I do want to stress that I am super happy to be having these conversations again. It feels like a long time coming, and it feels like we're getting back into a good rhythm now. And I hope that you guys are excited to go to Hawaii. I'm certainly jealous. So within the next couple of weeks, you will receive your handbook. This is something that our office prepares in collaboration with Professor Matthews to give you an overview and introduction to the site, reiterate your travel dates, which you should already have your travel booked, some of the policies and procedures we're going to go over today, and then housing details and arrival instructions. So that handbook, you know, you can kind of consider your on-site Bible. There's going to be information about how to get in touch with our office if you have an emergency, what to do in the case of certain incidents, and also a packing list that you may have already started to consider. So the first thing to go over is just your arrival and departure dates. So your program begins on your arrival date and ends on your departure date. And that may sound like a funny thing to say, but what that means is that you're expected to be there through that whole time, and WPI services are provided to you through that time. So we have booked your housing for those dates, and you will have a housing arranged for that time. We, especially in these times with COVID and changing entry requirements, we really do recommend that you plan to arrive on the arrival date and depart on the departure date. Although I know that with C-term, there may be some temptation to come a little early, or of course, you know, now that we're back to a good break schedule, possibly stay a little late. Just keep in mind that those times that you are not on the program, it is your responsibility to book your housing. And because you're outside of the program, some of the things I'm going to talk about in terms of safety and access to resources may not be the same before and after the program. That doesn't mean that we're not going to help you, but you know, we do expect that you have your own arrangements when it's outside of the time that we're there. This goes also for travel during the program. So Lauren, I don't know if you've talked about about island travel. Will people be going off of the Big Island or not? You're not on the Big Island. You're on Oahu, right?
Right. I've mentioned it to them a little bit, but we haven't really, I think they're a little overwhelmed at this point and not really thinking that far ahead, but they will.
Right. Yeah. And what I would advise is this is all part of, study abroad and study away. It's exciting, but it's also a little overwhelming. And your cohort, but you may not all be best friends. And you may be kind of feeling like, what am I going to do on the weekends? And I got to take advantage of everything. You will find things to do. You will have fun things to do on the weekends, and you will find that the group of you will get used to kind of, hey, I'm doing this if anybody's interested, sharing plans, but don't feel like you need to be booking everything right now. And certainly don't feel like you need to be spending more than you budgeted to spend during your time there. I would imagine you can spend every weekend in Honolulu and have an amazing time. So that comes from experience of that feeling of, the fear of missing out and thinking, oh, what do I have to do on the weekends? Right now it's about your project work. Right now it's about getting settled in. And you have 7 weeks to kind of explore and enjoy some.
Erin, it looks like there's some people in the waiting room, I think.
Oh, goodness, Kaylee. Yep. Thank you. If you see anybody else, just holler.
I think, well, I can't see the waiting room, so.
Okay, I see it. Or yeah, Slater, thank you. I don't know how you saw the waiting room.
She might have contacted him.
Texted. Yeah. Okay. Thanks so much. Anybody, just feel free to unmute and let me know. Okay, the other protocol is about free time and weekend travel. So speaking of, we do have a system with advisors where we ask them to collect weekend travel from your groups. What this usually looks like is a Google Doc, a shared doc that everybody can update, usually by Thursday or Friday, with your plans for the weekend. This is not to keep an eye on your every move, but this is only to use in the case of an emergency where we need to know who is where, and we need to kind of take stock of who may be in an emergency type of situation should it come up. A great example of that for Hawaii is potential of earthquakes, potential of, I don't know how potential this is, but volcano or some other disruption to travel. So we would need to be able to go back to this weekend travel and be aware of where you planned to go for that weekend and how we can get in touch with you if cell phone service is not working. So the form will ask you for what your plans are, who you'll be with, and where we can reach you. If another number to reach you if you're staying at a hotel, or another place where there's an alternate phone number. We're going to talk a little bit more about things to think about for weekend travel. The ones I'll highlight right now are just be aware of road travel and the risk of accidents. We'll talk about that a little more in a second. Think about companies that you're booking activities with. A really good resource for that can be TripAdvisor. Check reviews, see what people are saying about places. Even better resource is a local or somebody that knows a little bit more. So your sponsors might be a good resource for that. But, even if it means paying a little bit extra for the activity, if it seems like, the company is more reputable and has better reviews, I would always recommend going with that choice. And then, especially in a place like Hawaii, think about where you're swimming. And, the best kind of rule of thumb is if other people are not swimming, then you should not be swimming either. And, I think that signage will be pretty good in areas that you should not be swimming in. But there, for those of you that have maybe been in coastal situations more often, there can be changes in weather patterns where all of a sudden the undertow is stronger for a certain day, or there can be even changes in the algae. If you've ever heard of the red tide, I don't know if this happens in Hawaii, but that can be a reason not to swim. So just pay attention to signage, and certainly pay attention to what other people are doing. And if people are not swimming, then it's not safe to swim there. Last protocol is to expectations on being contactable and some reminders about housing. So first of all, you should have an active working cell phone for the whole time that you're there, that is on and charged and can receive and send text messages, and can receive and make calls. So for Hawaii, this should not be a problem. You may want to check with your carrier just to make sure that you have the same services, but most likely not a problem. If you think that you would need a local phone, you could start looking into that, but most of your phones should be working just fine. Excuse me. And you'll have Wi-Fi in the housing, so you can even use FaceTime, use iMessage if you have an iPhone on the Wi-Fi. So that shouldn't be a huge issue. Just remember that that is your best resource to get in touch with each other and to get in touch with Professor Matthews. So you may consider, having your ringer on in certain situations if you know that you're expecting a call from someone. And just checking your phone frequently, especially for any text messages that you could miss. Lauren, do you ever do like a WhatsApp group or a group messaging option, or no? Okay. So if there's any group messages to get out, just be aware of the options there, maybe coming via email or via text message. Okay. Housing. Biggest thing here is so you're living at an apartment complex. There's going to be other people that live there too, that could be staying for short-term or longer-term time periods. And they really just want to own up and be accountable for anything that is missing or damaged in your apartments. So if you arrive and, the microwave is cracked. I just had this happen to me over Thanksgiving. Make sure you tell somebody, make sure you make it known so that it's not an issue at checkout. And if something breaks, again, just make sure you let somebody know. We don't often have an issue with damages in our apartments. And, if a mug breaks and, there's an extra charge at the end of the term, not really a big deal. If something larger happens, there are times where we might pass on a damage fee, but that's very unlikely. And I would hope and expect that people would kind of own up to something if it was, a larger issue or something that was damaged inside. I would recommend bringing a suitcase lock, especially for those, valuable things or things that you just want to make sure are kept safe. That's a good kind of simple, easy way to have a safe or a lockable place to put your items. Do respect any rules that are asked of the apartment complex, and think about, Lauren, do we have regular cleaning services? Do you remember?
I actually am not sure about that. I'll inquire, but it's a COVID changing situation, so I don't know.
Yeah. Okay. I'm going to make a note of it too, and we can check on cleaning services. My feeling there is really just to be respectful of the people that come in to clean. If we do have cleaning services, just remember they're going to want to run the vacuum, and they're going to want to wipe down the countertops. If the floor is covered in clothes and if the countertops are covered in dirty dishes, it's going to be hard for them to do that kind of stuff. So just be respectful of the work that they need to do, and we'll confirm the cleaning schedule. Obviously no smoking inside, and most importantly, no overnight guests. So this goes for non-WPI and WPI. You should be staying in your own rooms, and the people sleeping there should be the people assigned to those rooms. Non-WPI guests, of course, if you have, a parent or a friend who's visiting, and they just want to stop in for a second while you're grabbing your stuff, that's not as big of an issue as people that you meet in Hawaii who you bring back to the apartment. That is a no-no. And the reason is based on experience. We don't want people in your apartment who you don't know well enough to know what their intentions of coming over are. And, that may sound a little overly, kind of wary of others, but there have been incidents where people have come over, used that opportunity to understand, okay, they keep their laptops right over here, or they keep their phones right on the countertop here, and then return later to take those things, or something goes missing. So better off, especially if you do have the chance to meet some people while you're there, to leave those encounters to outside of your housing. And that's in respect of your roommates as well. Any questions on that stuff? I'm just going to double check the waiting room. It looks like we have everybody. Okay. One last reminder is about any medication. So you're gone for 7 weeks. You're going to see Walgreens, you're going to see CVS, you're going to, see a lot of the same stores that you would see here in Massachusetts. The one thing that we strongly recommend is that you bring any prescription meds, and potentially any over-the-counter meds that you take regularly. Bring a full supply of those. So basically 2 months supply for the time that you're going to be gone. For prescriptions, yes, you may be able to get that prescription transferred to a pharmacy in Hawaii, but you really don't want to have to go through the hassle of that while you're there. And even for over the counter, if it's something that you regularly need, you may as well just have it while you're gone. Do make sure that they are excuse me, do make sure they're in the original bottles, with the scripts if it's a prescription, and in the Advil or Zyrtec container if it's an over-the-counter med. Okay, so now let's get into some of the health and safety questions. As you look at some of these headlines here, you may recognize some incidents that have happened over the past few years. And this doesn't even include COVID on here. This goes back to Ebola, if you remember that. And these are incidents that our office is watching over week by week, month by month, that is really part of our background responsibility for our programs all over the world. We are thinking about how they're impacting our groups. We're thinking about what shifts or changes we may need to be making, and whether or not we're able to travel somewhere. So some of those changes are even coming for C-term. We don't anticipate that for Hawaii, but we do anticipate that some of our C-term groups who could travel may not be able to. And obviously with COVID, we have, lots of roller coasters to ride when it comes to travel. So that's just a reality. But the question I have for you is, what do you think are the top 5 risks to US student travelers? And if you want to put them in the chat or unmute yourself, you can just throw out anything that you think might be in the top 5. Anybody got one?
Come on, guys, wake up.
Language barrier.
Language barrier. Yep. Communication. That could certainly come up. Mitchell says losing or getting IDs stolen. Yeah. What else? Yep. Kaylee says being unfamiliar with an area, people taking advantage of this. That could come along with language. What do you think is number 1? Max, travel accidents, flying or driving. Either you have traveled before on a WPI program, or you made a good guess, because these are the actual top 6 risks for US students traveling away. Number 1 is road traffic. Not even just flying, but driving overall, whether you are the driver or you are the passenger, is certainly a concern and a risk, and remains one of the biggest risks for travelers. Opportunistic crime, so that's going to be things like people taking advantage of you in an area where you're not familiar. Pre-existing health conditions. This is why we ask you for your health information and for you to do kind of a personal scan of what you think could come up while you're away. Because, you're in a new environment, maybe you don't have access to the same support network that you had at home, or, something just comes up that you would typically go to your general practitioner for. That's why we want to know. It's, our form is kind of like a help us help you in case there could be something that comes up while you're away. Drinking certainly is a concern, and kind of an overarching concern for many of these other risks. And I'll talk about that a little more in a second. Drowning, which for Hawaii is certainly a risk. And then sexual assault. And I know that you in the Canvas course looked over some of our modules there, and I'm just going to highlight a little bit of that at the end of this presentation too. So let's dive into a few of these. Before I do that, I want to point out that COVID is not one of the risks here. So, COVID and a pre-existing condition could be a risk. But I want to point out that while COVID has been at the forefront of many of our minds for a long time, for over 20 months now, our concern about restarting travel for the WPI programs is as much about the COVID risks and the COVID kind of environment in the places that we're going, as well as these risks to you and to our groups while you're going. So, my feeling as we restart travel is that, yes, we need to be aware of COVID, and I'm going to talk about that right after this slide. But I want you to also remain aware of these other places where you are more vulnerable when you're leaving campus, because we don't want to lose sight of that. So with that said, let's talk about COVID a little bit. We, unfortunately or fortunately, we in the DO office have become a little bit of our own public health team in close collaboration with the Health Services Department at WPI. And we've been watching the numbers very closely over the past 20 months. A lot of our metrics have changed and varied as we go. Obviously, you know, as vaccination came into play, that started to be part of their factors of deciding to restart travel, more so than some of the other things like positive test rate or even daily new cases. All of it is, so it's very nuanced, but I think it's important for you to understand kind of the numbers behind our decisions. All of these numbers and data come into play as we make a decision to go somewhere. So Massachusetts and Hawaii, this is just a comparison of where we're at in both states. Both states have remained high in vaccination rate and low in daily new cases and positivity rate. Obviously, that's changing over time. And as we go into the winter months in Massachusetts, and, you know, Hawaii is kind of more of a steady climate where people can stay outside a lot more. So that changes over time. But right now, both states are doing really well with vaccination. And if you look at the daily new cases per 100,000, Hawaii is very low, which is great. Massachusetts is a little bit on the upswing, which, like I said, is in part due to the winter months and many of us being inside again. But the overall decision for Hawaii is that, yes, we feel comfortable with travel with the same mitigations measures in place for your group during the time that you're there. So we know, I'm going to jump ahead to this slide first. So we know how to stay safe when it comes to COVID based on the information that we've learned over the last 20 months. So what I would continue to recommend to you is that you remain vigilant during the time that you're there in following these guidelines, because we know that they keep us safe. So masking indoors, for example, we know that transmission rates are higher indoors, and that especially in tight indoor spaces, there can be the likelihood of transmission is greater. So continue to mask indoors is certainly our recommendation. Masking outdoors when there's not the opportunity to social distance, of course, that's, you know, going to be up to kind of personal comfort level. And I would ask that you all do what you feel comfortable with and that you respect each other and, you know, in those decisions in those places. Masking in common areas, again, that's going to be a personal decision. If you are in your own living space, you don't need to be masked, you know, and that is something that you and your roommates can talk about if there's any concern. Keep in mind that while the numbers are low today, we don't know what February 21st is going to look like. You know, we don't have a crystal ball into the future. So if local guidance is changing, then you will be expected to follow local guidance. You know, and we are seeing that in Prague right now, for example. The Czech Republic has been on the upswing with cases, and we do have a group right there right now, and the group has been very good about following local guidance. They have a green pass system where everybody has to have a record of their vaccination on their phone to enter restaurants and other things. And our faculty advisor there said, you know, it's just kind of become second nature. So following whatever protocols are recommended in the local area is what we ask of you. We also won't be doing regular testing as we do on campus. So you won't be testing weekly. We will, however, have information for you about where to test if you're not feeling well, if you're symptomatic. And what I want to stress is that at the first, yourself, and we've all kind of gone through this at this point. If after a long plane ride you feel a little stuffy or you feel, kind of run down, if that feels like, oh, that's just from travel, and by the next day you feel a little bit better, great. If you have something where you are continuing to feel unwell, you've got, sore throat, stuffiness, and absolutely, the hands down indicator is still fever, then you should be seeking some help with getting seen by a medical professional and get it tested. So I think our best defense against the spread of COVID in a cohort situation is for each individual to really be vigilant about their own symptoms and about how they're feeling, and to be honest with one another. If you're not feeling well, to hang back for that day, or if you're if even in your roommate situation, if you say, hey, I'm just going to keep to my room until I know what's going on, better to be cautious than to kind of be cavalier about thinking that something is not COVID. So, and then keeping your advisor, keeping Professor Matthews in the loop. So if you are not feeling well, you take your temperature, you do have a fever, what you should be doing is contacting Professor Matthews immediately, and then going to the indicated location, which will likely be an urgent care close to your hotel, to see a medical professional. So we're not going to make any decisions. I am not a medical professional. Nobody that answers our emergency line for the GO office is a medical professional. We're not going to make any decisions on what you should be doing until you've been seen. We will, that said, be cautious about isolating someone should they feel symptomatic and we're waiting for testing. So we'll work with Professor Matthews. If someone's not feeling well, we'll work with Professor Matthews to say, okay, let's get their roommates to a hotel for the night while we're waiting for testing, or let's take some extra precautions. The difficulty with a cohort-based model like ours is that you guys are living together, you're working together, you're hanging out on the weekends together. So it's likely that if we have a positive case, that there'll be many close contacts because of how tightly knit you are. Our best defense for that is that we are requiring vaccination for everyone in the cohort. So our best defense for knowing that we have close contacts is knowing that those close contacts are vaccinated, and we know that the protocol for vaccinated individuals is different than it would be for a non-vaccinated person. So if you were identified as a close contact, you would not be needing to, quarantine in isolation. You would really just need to be testing 3 to 5 days post-exposure. And if this is to happen in a cohort, we'll be working closely with your group on what to do. But first and foremost, the most important thing is to just be monitoring yourself for symptoms and be careful, especially in public places. At the airport and on the plane, you'll notice that everybody is masked because it's required. It's an FAA requirement, and it's enforced. In other situations, in public indoor spaces, you may notice that some people are masked, some are not. You may have lots of opportunities to be outside in Hawaii, which I'm jealous about. So, you know, in those situations, I would advise to err on the side of caution and mask where you can. But you also just need to follow local regulations if it's required. I'm going to go back to this slide real quick. Let's see. So we will be in touch about testing before departure. Right now, there's no requirement to get into Hawaii. There was at one point a testing requirement for Hawaii. If that changes, we will be in touch about it. And if that changes in terms of what we would like cohorts to do, we'll be in touch as well. You won't need to get, at least for WPI, you won't need to get a PCR before arrival. But we may ask that you take a home test, which is a Buy Next Now test before you arrive. And we'll be in touch about how to do that. For most of you, this is going to happen at home. So if anything changes about that, though, just keep a close eye on your email, especially with this Omicron variant, which is not in the US yet, but could be. There may be some further testing requirements in Hawaii, and we're just going to have to keep an eye on that. Okay, so I want to go into a couple of the risks that I mentioned on our previous slide. The first of which is alcohol. So on those 6 risks, drinking certainly can exacerbate all of the other 5 things, or make it yourself more vulnerable to a road traffic accident, more vulnerable to an opportunistic crime, etc. Reminder that you are still a WPI student while you are on site, and that means that the code of conduct still applies. Some of you may be 21 at this point or turning 21 while you're in Hawaii. The drinking age is still 21. So we, if you are of legal drinking age, we advise you to drink responsibly, in moderation. Remember while you're there to complete your project work. And especially for those of you that are 21, I want to remind you that supplying alcohol for your under 21 teammates or cohort mates is considered supplying alcohol to a minor and would be considered that way with the code of conduct. So, we will not be policing your drinking. In no way is Professor Matthews, going to be doing room checks or, trying to find out where you're going at night or that type of thing. For us, it's really about the behavior associated with drinking. And if we have noise violations from the apartment complex, if we have other concerns for safety that come out that involve alcohol, that's when we would address the alcohol itself. And, we just ask you to be careful and be cautious when it comes to alcohol. Another thing that we ask is that you stay together. So like I said, you're going to find that you as a cohort kind of stick together naturally when it comes to weekend travel. And just keeping in mind that you can all make the experience better for each other just by being open and being inviting to others. So if you find awesome weekend excursion. And, you know, if you get 10 people, the cost goes down. Send it out to the whole group and, you know, see who else can come and be open to inviting other people. That's going to make the experience better for you, and it's going to make the experience better for the other people in your cohort. And really, you know, the way I look at it is you're kind of all in this together for the time that you're there. And we always recommend that you're in a group at least of 3 people. So, yeah, especially at night, if you're walking somewhere, we would recommend that you're at least with 3 other people so that if something happens, one person can go for help, one person can stay with someone. This could even be a twisted ankle, you know, something that, you know, just needs attention immediately. So, so stick with each other. The other thing that I think is really important, especially as we kind of come out of this time of dealing with COVID, living on campus or close to campus, and you know, the excitement of kind of getting back out there and getting to travel, is remember that that excitement can also come with new worries or new anxieties around being in a new place or kind of getting settled into a new routine. And it's important to be forgiving of yourself in those situations, and also forgiving of one another. You know, if somebody says, I just need a night alone tonight, recognizing that everybody kind of responds to new situations in different ways. There are resources to help in these situations. And we will be sending out an email closer to the time that you leave, or I think it's actually a week into your program. We'll send a reminder of some of these resources. Our international travel assistance plan has 5 emotional support counseling sessions. Those are available to our domestic travelers as well. So we'll send you information about how to access that. Literally, you just call, you say you'd like to access the resource. Nothing is shared with our office beyond a user access the resource. They don't tell us where or who, unless there was concern for your personal safety or the safety of others. There is a new 24/7 on-campus support system as well. If you haven't heard about that yet, it should be coming soon. This is a resource where you can talk to a counselor 24/7, and you don't have to be in Massachusetts to access it. So that's kind of a cool thing that's coming online as a second resource to you. And then the SDCC is always there for our students. They can't provide regular services based on their licensing. So they can't, if you meet with them regularly, you may have already talked about this with your counselor, but they can't have regular sessions, but they can certainly do a consult. They can certainly talk through an issue and make some recommendations about next steps. So, you know, that support system remains in place, and especially through our office, can also remain in place for something you're struggling with or something that you notice somebody else is struggling with. So recognizing the kind of signs and symptoms of somebody that is having trouble with mental health is going to be the first step in kind of getting help with the situation. So you may see a teammate or a roommate who seems withdrawn. They're not coming out of their room often, or they're not participating like they would normally in the group setting. Better to get either our office or Professor Matthews involved early, rather than let something fester and kind of feel like, well, I think something's wrong, but I don't know. By this point, once you're on site, you're going to know each other a little bit better and potentially be able to recognize when somebody's acting a little bit differently. And, you know, this could come from homesickness. This could come from feeling kind of out of place in a new situation. But like I said, be forgiving of yourself, be forgiving of each other, and just watch out for each other. Does somebody have something to say? Okay. Here's just some reminders on things you can do. This, you know, may be a situation where you feel a little bit out of place and asking somebody how they're doing. But think about what you would want to hear. You know, you might not want to have somebody jump to finding a solution or telling you to just suck it up and, you know, and move on. Sometimes what people want to hear is, that sucks and I'm sorry. And I'm sorry you're going through that. And, you know, I'm here for you. And then that may be all that somebody needs to hear, or they just need to get something off their chest. So, especially in the first couple of weeks, you're getting settled in, you're going to have some jet lag because Hawaii's pretty far away. It's further away than some of our European destinations. So, you know, that it's not going to come as easy to all of you in that transition. And these are just some ways to kind of support one another through that. Speaking of support, I want to jump finally to a reminder of some of these slides that were part of our Canvas course around sexual assault. The reason we bring this up at this stage and at this, you know, before you go away, is that the trend becomes there can be a rise in incidents of sexual assault or sexual violence around coming to a college setting, being in a new setting and being in a new environment. And then around the time of going away or a study away situation where you're also in a new environment and in a new situation. So that's not to say that that's always where something would happen, but it is times when you may be meeting people who seem trustworthy or seem like an exciting, you know, new acquaintance, and things don't go as planned. So whatever that looks like, I think, again, I encourage you to be a support to one another. And again, remember some of these areas where you can help a friend or help a colleague through a situation without feeling like you need to dive in and be the, you know, the superhero in the situation. What we have, you know, on our side, and what we have, you know, kind of a responsibility to, is being a resource to somebody that's going through an incident of a sexual assault, sexual violence, or sexual harassment. Professor Matthews, myself, the other staff members on this call are all responsible for reporting these incidents as part of Title IX. So this doesn't mean that we have to, you know, report this incident to the world. It means that we need to make sure that the Title IX coordinator at WPI is aware of an incident, and that the person involved has been connected to them so that they can get connected to the right resources. When it comes to support, this is just a reiteration of what was on the Canvas course, but you do have confidential resources available to you. Those are listed here. There will be in your handbook some other non-WPI support services available or listed there as well. And this is a great place where the SDCC is available too. Just knowing that your faculty and the staff at GEO are non-confidential, but that only means that would be shared with the Title IX coordinator. I think that's the most important place. And when you're in an off-campus setting, we just want to make sure that you have the right resources and are getting the right care. So in an off-campus setting, there could be some other people involved if we were trying to just make sure that somebody had the right care. But that's just a reminder from the course. Okay, so that is all I have. It's about 12:50 if anybody needs to hop off. But I'm happy to take any questions if you have them. Or Lauren, if I missed anything and you want to, you have anything to add, I'll pull down the slides and we can chat. Any questions?
Can I just add, since I actually have the whole group here rather than 4 individual teams, can I ask if anybody at this point is unconfident about where they are in the Safe Travels registration process? I guess I'm taking it on faith that they're all there and listening. So it's not that difficult. If you're confident, you're probably right, but just remember it's your responsibility, and no one's going to be there to help you try to actually get access to the islands. So you got to make sure that you have all the information you need.
Great. Are we missing anyone? I count 6, 10, 11, 12,
I think
13.
someone left. There were 19 and there's 3 of us, right? So there should be 16 students.
Okay, Ari said she had to leave a little early.
Oh, Ari's still here though.
Oh,
Someone else left and I can't figure out who it is. But they were all here. There were 19.
excellent. I recorded this, so I just would send it out if we missed somebody. Well, if there's not any questions, I really do wish you a great trip. We will be sending out the handbook shortly and any details about housing that you need to know before you arrive. And otherwise, just wrap up B term and get ready for the sunshine.
They're a little shell-shocked by the end of B term, I think, as are we all.
I know. It's coming like a bear, but it'll be over and you can go home for a little bit.
I'll see all of you tomorrow. Bye, guys.
Okay.
Thank you.
Erin, I have
Bye.
to, while I have you on, I
Yeah,
need
sure.
to check with you about, I need to amend the housing contract.
Okay.
And I know Julie's out, so.
Yeah, I